Okay, we'll get started. Welcome everyone to Grand Rounds today. Thank you for coming. And just as a reminder for those of you in person, if you need a parking validation, we have passes in the back of the room along with the bagels and donuts for those of you online who want to be tempted to come in. To introduce today's very special guest, Dr. Malani from University of Michigan, we have Dr. Dave Andes, our Division Chief of Infectious Diseases.
Thank you and good morning. It's my pleasure to welcome Dr. Preeti Malani, who's a professor at the University of Michigan. By way of introduction, Dr. Malani completed her undergraduate at University of Michigan, her medical school at Wayne State, then went back to Michigan for residency and infectious disease fellowship, and then took additional training, completing a fellowship at OHSU in geriatrics. She wears many hats at the University of Michigan. She's the chief health officer, in addition to being an infectious disease physician. She's also the deputy director of JAMA and is the recent past director of the National Health Policy on Health Aging. Dr. Malani is an expert and has contributed significantly to our understanding of infection prevention and antimicrobial stewardship, especially in the geriatric population. And she's also an expert in scientific communication, which was particularly critical during the pandemic. She's going to talk to us today about the art of aging during a pandemic, insights from the National Poll on Healthy Aging. Welcome.
Thank you. Thank you so much for a kind introduction, and to everyone out there who is observing and celebrating holidays. Your best wishes and peace to you and your family. So just gonna keep going. Okay, thank you. It's interesting. We used to have grand rounds when I was an intern at 8 a.m. and it was like sort of like nap time, really. But the one grand rounds I remember is Dr. Craig coming from Wisconsin to speak about PK, PD, pharmacokinetics. I probably tried to stay awake. And so it feels like really a big thrill for the William A. Craig professor to introduce me at Wisconsin. It really feels like a full circle moment, and I think an unlikely moment in a lot of ways. So thank you for the invitation, the kind introduction. I'm going to talk about the pandemic, but maybe not in the way that you might expect an infectious disease physician to talk about it. For me, and I actually am now a special advisor to the president. I was the chief health officer up till last July. For me, the pandemic really began in January 2020, and we have a big, much like University of Wisconsin, we have a lot of students and faculty with collaborations in China. And things weren't looking so good there. And so we began to plan and to bring people to really think about bringing people back. And I'm going to start there. So I also wanted to just take a moment to reflect on the origins of the land. So anyway, back to the pandemic. My life was getting complicated. People were starting to have conversations around things that sounded crazy to me, like people are going to be home for months, maybe a year, and we're going to do school online. It's not going to happen. And cities started to shut down. And my editor at JAMA at the time, Howard Bachner, said, "You know what I need you to do? I need you to write something for clinicians." And I was like barely getting through every day at that point. I was like planning birthday party for my daughter and like just trying to get through. And then, I ended up phoning a friend, and these photos here are really taken from about 3 years ago. And Ann Arbor and Madison, people always compare them. And On the right is a completely empty kiosk on campus. Those kiosks get chills when I say that, like just everything was canceled. But what I did when I was asked to write something is I phoned a friend, and many of you know this friend, Carlos Del Rio. If you're on Twitter, you know him. Really good friend of mine. And he was like spending a lot of time tweeting about this novel coronavirus. So I said, Carlos, you want to write something with me for JAMA? Howard wants something. And so what happened was we ended up writing this, and we ended up writing another probably about 10 or 11 sort of sporadic viewpoints. And the reason I just want to spend about 5 minutes reading like little excerpts just to kind of remind people of where we were, because I think thankfully we have forgotten. So this was in February 5th, 2020. As of February 4th, 20,000 cases of this novel virus have been reported, 98.9 of them in China, 400 deaths. About a third of the patients are developing ARDS and require care in the intensive care unit. This is particularly true for patients with comorbid conditions like diabetes and hypertension. And we go on to talk about, if you see a patient who traveled to Hubei province in the last 14 days and has a cough, call your neighborhood infection prevention person and like your health department. And we close with I think some will control this outbreak is unclear because currently there's no vaccine. The effectiveness of antivirals is unproven. However, basic public health measures such as staying home when ill, hand washing, and respiratory etiquette, including covering the mouth and nose during sneezing and coughing, were effective in controlling SARS. About 4 weeks later, we wrote another one because it was just changing so fast, and that's the title here. February 26th, approximately 95% of cases and deaths were in China. Oh, but by the way, we've seen cases in 49 countries. Remember that when it was like, what countries have this? Case fatality rate, 8 to 15% in older adults. And I'm trying to kind of set the stage because I'm going to talk about older adults in the pandemic. And then a comment that WHO and CDC recommend screening based on travel to China. However, the increasing number of cases in other countries, South Korea, Italy, and Japan, and a recent case in California, with no history of travel or known contact, will likely soon lead to changes in screening recommendations. 100 clinical trials for sort of novel and repurposed compounds, and 11 vaccine candidates. So already within weeks, right before things really got hectic in the US. April 6th, by this point, those are the photos, right? So actually just about almost exactly 3 years ago to the day, since the first case of coronavirus 19 was identified in Washington state, more than 235,000 cases in the US in 2 months. And we ask about, can patients be reinfected? How long does immunity last? Should everyone wear a mask in public? Remember this? Due to the current scarcity of masks, many in the community have begun sewing masks for themselves and for healthcare workers. When will a vaccine be available? They were candidates were moving to phase 1 trials. And we, kind of moving forward to May, 5 million infections, things like herd immunity, second wave. Then we started thinking about long-term consequences, 30 million infections. This was now by October, cardiovascular, pulmonary, neurologic, and a section that I insisted we include, I'm going to read part of it, emotional health and well-being. A diagnosis of COVID-19 and subsequent need for physical distancing has been associated with feelings of isolation and loneliness. I went on to talk about stigma, compounded by the psychological toll of the pandemic experienced population-wide. Individuals recovering from COVID-19 may be at even greater risk of depression, anxiety, post-traumatic stress disorder, and substance use disorder. And just the idea of like, this is going to be enormous, the emotional aspects. Continuing uncertainty. Now we're a year later. What vaccine should we use? What do you do when you're vaccinated? What can you do? Then Delta came, and it turns out, oh, you know, psych, vaccine doesn't work. And then Omicron, and, you know, we all remember, you know, like, was this going to ever end? And then therapeutics came, which was wonderful. And this is the last one in our, I don't know, we might need to write another one. Carlos is now the interim dean, so he's gotten very busy. But you know, the idea of subvariants of Omicron and therapeutics. And, you know, with that, I'm going to like just kind of really hopefully set you up for my main comments. And I'm going to share a couple of pictures, and these are shared with permission. When I spoke to a group in the community, the man in this photo, his name is Paul, he gave me this picture. This is from the spring of 2020. He is outside with an N95 mask on. His family hung up a plastic shower curtain so that he could hug his 10-year-old grandchild. You know, I mean, it's just an incredible image. And he shared it with me because I was talking about loneliness and then, you know, closer to home, this is Hannah Ernst. She's about 25 in this picture. She has Angelman syndrome. She's the daughter of my very dear friends, Susan and Rob Ernst, my close colleagues. And Hannah loves very deeply and loves her grandmother, who is inside, unable to safely be with her granddaughter. You know, and so I want you to really think about these pictures as we're going to get into the meat of things. The Institute for Healthcare Policy and Innovation at the University of Michigan is a multidisciplinary institute. We have about 700 faculty from almost all of our 19 schools and colleges, all health services, researchers, really, and everything from people like me who, you know, sort of do it more as a hobby to people who are, you know, running large centers. It's the largest university center. And a number of years ago, the leadership said, you know, we really should focus on aging. We need to do something in this space is going to be important. And this kind of led to discussions around the national poll on healthy aging. And, you know, this work really grew out of a desire to better understand the day-to-day lives of older adults. What are their experiences with health and healthcare? And what are the issues that matter most to them? I think everyone is aware that Americans are living and working longer than ever, and being healthy in every sense of that word, physically, socially, emotionally, spiritually, is important to older adults and their families. And again, sort of a remarkable number. Within a century, people are living 3 decades longer. And then there are people like this patient, Mark Saul, also shared with permission. This photo is actually almost 20 years old now. When I was a geriatrics fellow, this was taken just after his 103rd birthday, and he went on to live for another few years. He actually wasn't on any medications when he first arrived at this facility. He was actually driving well into his late 90s, you know, so that those like sort of super agers, the longevity is there. And again, over the next decade, and these are off by a decade, census numbers, the 50 plus population is going to grow at a much higher rate than the 18 to 49-year-old population. So from just a money and economic and population standpoint, the idea of aging and pre-aging is really important. Why does it matter? Well, money, right? That's a kind of an easy answer. 85% of people in this age group have gotten prescription medications the past month. 33% have been in an emergency department in the past 3 years, and about half have been to a dentist. And if you ask people what's most important, comes from an AARP member survey. Staying mentally sharp, having Medicare in the future, living a healthy, and they're also concerned about declining physical health. And this is a AARP member survey from 2016, but those things haven't changed. This is I think again another photo. This is my grandmother. This photo was taken a number of years ago. She actually would have been 100 this year, but she passed away during the early days of the pandemic, not from COVID. But my brother and I used to call her the general, because she was like this. We were like, what's the general up to? she had a saying in Hindi that's "Jab tak haath pav chalte, tab tak theek hai," which means as long as my hands and feet work, it's all good. And for her, being independent was everything. And actually, until the day, really, she was quite independent, fiercely independent, although slowing down at 97. And then she suffered a stroke and actually passed away a couple weeks later. And that was, again, very pandemic. Got a taste of caregiving in our family from that. So just shifting back to the National Poll on Healthy Aging, just a little bit of background, and I would refer any of you to the website healthyagingpoll.org. This is a recurring nationally representative household survey of older adults, so 50 to 80. And I again emphasize aging and sort of pre-aging, people who are working and thinking about retirement, thinking about caregiving. The overall goal was really to move beyond traditional medical issues and get at all aspects of health and well-being. Focus, because again, this population is just so critical to any discussion around policy. I will say that one of the things, and again, a little bit about the poll, and this is all on the website, NORC. So we use the NORC panel. We used to use Ipsos knowledge panel. We filled a couple times a year, about 2,000 people, really good completion rates in the 70 to 80. The samples weight reflect the US population. And we're just about, actually, right now, the work has been so successful that the state of Michigan, now we're going to probably develop a more localized poll. And again, Michigan and Wisconsin share a lot, not just geography. Demographically, we're pretty similar in some of the issues that are really pertinent to our states. We have in almost our 6th birthday is coming up in June, and we have published 53 reports, and the topics are everything from brain health to sexuality to marijuana, loneliness, ageism, and I'll mention several that are pertinent to the pandemic. And I will point out too that AARP has been a partner for us, and they are a sponsor to the poll, and their research team has actually been very important to our dissemination efforts, and also like giving us ideas. And it's been a non-traditional kind of funding. We think of NIH and other funding, federal funding agencies, foundations, but they've been a really wonderful partner. And I think a lot of the success has been because of the visibility of AARP, and I think they have 38 million members, and their magazine is one of the most highly circulated. I think People magazine might be a little bit better, but so when the pandemic hit, and I'm talking about March-ish of 2020, older adults, and I tried to really pull out a couple comments from those viewpoints that Carlos and I wrote about how we kept saying, older adults, so dangerous, you can't leave your house. And I think even in my own family, my parents, my brother is an infectious disease physician. I know some of you know him. He and I were like really concerned about our parents, and we're like, listen, stay home, don't go anywhere. We'll take care of what you need. And I think, what that did in terms of isolation and loneliness is something I want to talk about. And I think it goes without question, the pandemic was extraordinarily difficult for all of us in different ways. And I think about people with young children. I think about people with, my children are young adults, and how it was difficult for them also. But older adults really had to just take themselves out of circulation. The things that really contributed to health became dangerous. And they really had to be taken away from very meaningful activities and family and friends. And when it became clear that the pandemic wasn't going to be a short-term thing, our poll team also tried to really pivot and take that moment to really capture what was happening. And this is actually, I think, one of my most favorite pieces of research that we've done. And this was, simple, like 3 questions around loneliness. And we had polled on this issue in October of 2018. And when we talk about loneliness, we talk about a lack of companionship. And those are the words we use, and then isolation. And I'm glad that medical community is actually starting to use these words and talking about this as a health issue, because it is a very big health issue. In 2018, about a third felt a lack of companionship, 27% felt isolated, and there was 28% had very infrequent social contacts, like they would go a week or more without ever seeing anybody. And those numbers went up dramatically during the pandemic. 56% felt isolated, 41% lacked companionship. And we have tracked this number, and we just presented these data from 2023. And I just want to point out that we haven't gone back to that baseline. Gotten better, and we're not at 56%, but we haven't quite gotten back there. And I just want to take a moment with my chief health officer and mom hat. If we were to go out on this campus and do a similar poll, the numbers would be higher. I think they would just astound you. Probably not as robust of a poll, but some of the polling we've done at the University of Michigan, 61% pre-pandemic of our students say, I am very lonely. And I find that incredibly sad and hard to understand, but loneliness is a public health issue, just like COVID is a public health issue. And I think it's complicated, just like COVID. Some of the activities that older adults participated in terms of promoting social interaction are listed here. Connecting with friends and family via social media, which, it has good and bad, some, I'm sure many of you have experiences with that, including I recently texted my mom and I said, I think someone has hacked your Facebook, because, so she's kind of, we're like, don't friend people that you really don't know. Like, it's kind of like, same conversation that you have with your children. But 46% interacted with people in their neighborhood. You remember that? I got to know neighbors that I never knew, having lived there for years. 31% were connecting with family via video chat. And I know my children do this with their grandparents, and they really enjoy it. I want to talk about something too, which is sort of equity in terms of isolation, right? We would tell people, we got to isolate. And we were interested in terms of like where people were, like, did they even have a place to isolate? And the overall numbers were about 18% did not have a place to safely isolate. Now, this was different when we looked at it by self-reported race and ethnicity. 31% of Hispanic respondents, 25% of Black respondents, and 14% of white respondents. And of course, this is a social determinants of health issue. And when we, talk about, go home and, stay in your own room with your own bathroom. And again, these were big equity issues on college campuses also, especially for students when things shut down and they had to go home. And really home was not a place where they could learn and continue their education. I'm going to switch gears now to disrupted care. And, this is something that has affected some of us personally also. People had dental appointments and doctor's appointments on the calendar, and things got canceled. And we were interested in how much care got disrupted. And we polled on this in January 2022, and you could see that 31% of dental appointments, 29% primary care, procedures, including cancer screenings. A lot of people are way behind on cancer screenings. And again, we were just sort of interested, and we broke it down by whether people had been vaccinated or not. And you can see that rescheduling was more likely among the people who were vaccinated, which, you can theorize and sort of understand what that means in terms of health literacy, trust, and other things. But I just bring this up, and anyone who is in primary care or, any of us who've had our own care disrupted understand that these effects are going to go on for years. One thing that did change too is telehealth, right? This was something that really overnight sweeping changes to how we were delivering care. And we had, as a poll team, polled on this in 2019. And in May of 2019, when we were polling on telehealth, I have to say, I thought it was sort of like crazy that we were polling on telehealth. I'm like, this is like never going to happen. This is like, George Jetson in the future, if those, that's a little, cultural reference for, depending on if you're my generation or not, but this just seemed like, to me, maybe surgeons will use it for post-op care, and yeah, maybe, dermatologists, but this wasn't going to be how I was going to ever deliver care. That was my feeling. And of course, only 4% had used it in 2019. By 2020, March to June, 26% had used it. And again, this continues, and I think it is something that we've sort of figured it out. It's not as bad as you think. And actually, I enjoy my video clinic when I do it. The concerns that older adults had, that health, and these are in their own, this is their opinion on this. 75% were concerned that healthcare providers couldn't conduct an exam. 2/3 thought the quality of care was not as good as compared to in-person. And, maybe this is changing. We should probably repoll on this. 45% were concerned that they were not connected personally to their healthcare providers. And, I think that is something personally to me, that seeing someone in follow-up is different than seeing them new. At least just, that's how I feel. 25% having difficulty seeing and hearing. And again, I watched this with my grandmother and my parents, who are in their 80s, trying to, sort of navigate a video visit with her primary care provider, during the pandemic when everything was shut down. And, you can imagine it was not very effective. 24% had privacy concerns. I suspect that number is better. The other piece that's not on there is the idea of comfort with technology. And while most of the people responding to the poll found it pretty easy, either very easy or somewhat easy, that wasn't the case for everyone. And again, the poll is delivered electronically. So there's a selection bias. We miss the high end and the low end for sure. But I think that equity piece is so important. And navigation, there was an essay in a piece of my mind in JAMA a few months ago, written by a professor from UCSF, who talked about trying to help her parents get Paxlovid, and how she was just so frustrated. And like, how does anybody do this who doesn't have, power and privilege? And so I think systems to really help with the navigation, where you can actually call a real person, to help walk you through, are important. And this was a poll we did in 2018 around portal access. And as you may remember, getting vaccinated required being on the portal early on. Like, you had to make an appointment. You couldn't call to make an appointment. And so that was also a big equity issue. In 2018, we found only about half of people in the 50 to 80-year-old age group were using patient portals. We actually wrote subsequent papers on this, really talking about navigation. And as you can imagine, people with lower incomes, lower education were less likely to use portals. And they often had more complex health needs, and so probably could have benefited. I'm going to talk about vaccines. So we polled on vaccines in 2020. So before the vaccines, I think a lot of us were kind of wondering about these vaccines and whether, the safety and things. This was in October of 2020. We asked about, are you going to get vaccinated? And 20% wanted to get vaccinated as soon as possible. 46% wanted to get it, but wanted others to get it first. 20% were unsure, and 14% didn't want to get it. And trusted sources of health information, and again, this goes way back, and this remains such an issue, and we'll talk about it here. How well it works, their own research, recommended by their doctor, 52%. That was important. And I think that we were talking about this last night at dinner, that in a way there's an exhaustion emotionally around this, but vaccination is still important. And as our other healthcare preventative processes. And so this is something that your own doctor ends up mattering a lot. We wrote a piece before vaccination was available based on this poll. And I'm just going to read this because I think it, this is the last paragraph. It was ultimately having a highly effective and safe vaccine that large numbers of people are hesitant to receive would be tragic. It is tragic. The availability of a vaccine will not end the pandemic on its own, but will require high uptake and completion of both doses. At that time, it was 2 doses to reach its mitigation potential. However, given widespread transmission across the US and the risk of serious illness among older adults in particular, the choice between developing COVID-19 and taking a vaccine, even if an individual has some lingering safety concerns, may ultimately be an easy one. I just think it's kind of funny to kind of go back and read what you wrote. Unfortunately, some of this ended up quite true. We asked this more recently, this was last summer, and this is among older adults who had been vaccinated for COVID already. Are you going to get a booster in the fall? And a lot of people said no. And so I think, people who initially accepted the vaccine, and again, the numbers show this, and, all of our clinical experience shows this. And we were talking, Dave and I were talking this morning, that new variant is coming or is emerging. And so, we may be having these conversations again. Okay. Switching gears to mental health. And we talk about mental health a lot with young people, especially in like, what's the pandemic done? And this is older adults talking about mental health. And 87% reported that they felt comfortable talking about their mental health. It's an extraordinarily high number, basically. And when I'm not going to show those numbers today, but when we asked about sexual health, very similar number. People they want to talk about mental health. They want to talk about sexual health. In the past 2 years, 19% had discussed a mental health concern with their primary care provider, and 10% met with a mental health professional. I think, frankly, those numbers are probably too low. Like they seem like we're missing an opportunity, and maybe it's because we're dealing with other important issues. In terms of the pandemic, 28% reported worse anxiety or worry. 19% reported worse sleep, and 19% reported worse depression or sadness. And this is sort of beyond baseline. And again, I think the numbers in younger people are actually higher than this. Alcohol use, which this is something that we do screen for. We often ask about. So we asked older adults, and if you can remember early on in the pandemic, lots of memes about, wine and how much wine you need for the pandemic and things. Well, 67% reported that they drank alcohol. 10% reported drinking while using other drugs, and in particular, opiates. And so there was a lot of, potentially big safety issues. And this is, national, across the nation. That's a lot of people. 20% drank 4 times a week or more. And 26% reported having 6+ drinks at least one occasion. So what we think of is like a sort of a binge drink or excessive drinking. Some of the takeaways we had was that there was an association between feeling lonely and changes in alcohol use during the pandemic. And that, that may seem, very, of course, but to actually see that connection was something we thought was important. And the older adults who reported lack of companionship were the most likely to say that they had increased their alcohol use during the pandemic. And, I was talking to a friend from college this past weekend, and this individual's, one of her children has really is struggling a lot right now with mental health. And she shared with me that she found out that her child was drinking, but not drinking with other people, which, really seemed very different than the kind of drinking that we did when we were younger, where it was a very social thing. And I think, again, we're seeing that in older adults too, that in some ways this is like a self-medication or, an escape. And so I hope we can focus on that. Physical functioning and falls. So we were interested in people are they more active, less active, what's going on? And, remember people walking during the early days of the pandemic, like every day, get out there, walk. And 21% were, only getting, so once a week, we're getting moderate or vigorous activity for 30 minutes. About half several times a week, and then 28% nearly every day. But in terms of change in physical activity during the pandemic, 37% were less active. Only 13% were more active, and about half didn't have any change. And why is this important? Well, falls, right? Falls are really important. And 25% reported having a fall, like a significant fall during March of 2020 to January 2021. For anyone who works in primary care, geriatrics, hospital medicine, this is an incredible number, right? Like a quarter of people had a fall, and 70% had an injury. And again, the delay of care or not getting care because they were afraid to go to the emergency. You remember those days? People are afraid to go to the emergency. They're not afraid anymore. Our emergency department's overflowing. I'm sure yours is as well. But people weren't getting the care they needed after they fell. And we actually wrote these results up in a peer-reviewed manuscript in Journal of American Geriatric Society. And it was, if anyone's interested in that, it has a lot more detail. So it was not all doom and gloom. Like there were some good things that happened during the pandemic also. And we wanted to really ask about joys and stress, like the idea that you can have both. There's also some joy even during a pandemic. And actually this sort of graphic that's a little bit harder to see here. What people reported was that they had a little bit of both. Like there was a lot of joy and a lot of stress. And then there was, some joy and some stress, and then, very little. And you could see here, it was just sort of, I would put myself in this category where there's a lot of joy in my life, but there's also a lot of stress. And it depends on the day and it depends on the moment. And I actually really try to focus on the joy, but sometimes this gets in the way. Sources of joy for older adults: being outdoors, physical activity, hobbies, skills, projects, being alone. And I want to just comment on that because we talked about loneliness and isolation. That's different than solitude, right? I think, I like to be alone sometimes, right? Like, and I think that's a very different concept than the idea of loneliness and isolation. Pets, 56% found joy in their pets. And in fact, we did poll about pets during the pandemic. 10%, yeah. Again, like I said, not traditional medical issues, right? This was since March of 2020. Do you remember that, like that full on run on animals at the humane societies, right? All the shelters emptied out. So 10% got a pet since March of 2020. And this was in January of 2021. 59% owned a pet. And it was especially true for families that had children in the house. And my family was one of them that got a pandemic pet. Unfortunately, and I won't get it, unfortunately, it didn't end well for our pet. But that's another very sad story. But we did have our pandemic puppy, that's Sully, and that's my family. I want to shift gears a little bit to ageism and health. And, this idea of discrimination, prejudice, and stereotyping based on age. And we talk a lot about the isms, and ageism is a really important one from the idea of health. And, technically it's like, the idea of age-based discrimination in employment, housing, healthcare. These can all have very, very negative effects on older adults. And so we were interested in this, what are people's experiences with ageism? And 82% experienced one or more forms of everyday ageism. And again, I'll share the reference here. We wrote a manuscript and sort of created a paradigm for everyday ageism. And we worked with a really very, very thoughtful social scientist who was interested in this work. 65% reported exposure to ageist messages. 45% reported ageism in interpersonal interactions. And 36% reported internalized ageism, which is really interesting that they themselves, felt like they were critical of themselves. But a lot of people also had very positive views on aging. And, again, I want to leave us with sort of an uplifting, something uplifting to think about. And 88% feel more comfortable being themselves. 80% have a strong sense of purpose. And we talk about purpose is really important for all of us, but we talk about that with healthcare workers, with young adults. 67% feel more positive about aging than they feel more positive than they thought they would. And 65% think their life is better than they thought it would be. That's pretty good. And we wrote these results up also in JAMA Network Open. And it's actually, sort of one of those interesting papers that I'm really proud of, experiences of everyday ageism in the health of older US adults. And this is the grandmother, also shared with permission of one of our deputy director, Erica Solway. This is her grandmother doing Pilates well into her 90s. It's actually on the studio's website. And I just think that that's like just such a great picture. I want to thank my team. In Michigan, we talk about the team, and we have an amazing team who really do this work. Jeff Colgren, who's here, is now the director. He was the assistant director, and as I've stepped away to pursue more work at JAMA, he stepped in, and he's a really talented health services researcher. Erica Solway, who's kind of behind here, is our deputy director. She was a Hill staffer for a long time, working in that space. I joke she likes to go to did anyone see the geezer happy hour thing in the New York Times from Ann Arbor? So I'm like, that's where Erica would be if you found her, even though she's quite young. But she has a deep love for older adults and really amazing policy mind. Diane Singer is our manager. I want to particularly thank Emily Smith, who's our designer. So all these amazing slides are her work. Megan and Kara do our communications, and then Matthias is our analyst. We also, we have a number of other people that really support this work. And of course, our colleagues at AARP, research colleagues, particularly Terry Keenan and her team have been with us really since day one. And I'm going to leave you with information to check out this work. Thank you.
Great. Thank you for a really interesting and thought-provoking discussion. Maybe I'll start off by asking you more about the interaction, the collaboration with AARP, which, I was fascinated about. And what do you think the other opportunities for that, particularly when we think about dissemination and
Yeah, thank you for that question, Lynn. So AARP, it was, again, I think, for those of you who, especially if you're doing work that doesn't fit into like a clean, this is the study section where I can go and get money to do my work. We had our government relations folks who are based in DC had met the research folks there and kind of started talking about this. And, I will say that we have a longstanding children's health poll at Michigan. It's called the National Child Health Poll. And part of it was like, wow, could we do it for older adults, and who could help us? And so those conversations started like 2 years before we actually got going. And they fund about half of the poll costs. So it's really like, and it really did require, like, the intellectual work is done at Michigan, but they are part of the team. They come out, we go out there. We haven't as much with the pandemic, but I think that they have a real interest in being part of the, and again, they've got like this big consumer front area, then they've got like advocacy, then they've got research. And I'm amazed because their building is like a whole block in DC. And they don't know where like people's offices are in the building because they never, this is pre-pandemic, that they work in such distinct areas. But these are policy researchers, and it's we were cautious when we started, and I cannot say enough about it. And I hope that there are more AARP-like collaborations. Yeah, thank you.
Yeah. You want to, you can run up.
Sure.
You're younger.
Wonderful and important topics. One thing I'm wondering is, and undoubtedly within your survey, you probably also considered, within the realm of purposeful living, the impact of pandemic on employment in older persons, because many older individuals will work well into their 70s, 80s, and that drives action. Wondering what perspectives you might have on that.
Thank you for that question. One of the studies that I didn't share, actually, and again, it's one of our most fascinating studies, was the idea of worrying about health insurance and timing of retirement. And it was, I think it was in, and we found that a lot of people were not leaving their jobs because, or they reported not leaving. And again, this is pre-pandemic, when now things are not having health insurance. And in fact, 27%, if I remember correctly, worried about having health insurance. And the reason it's important and impactful is my senator and your senator, Senator Baldwin, Senator Stabenow, actually put forth a Medicare at 50 bill, and they cited this work. And I thought that was pretty awesome that the work actually got to that level. And again, I think people don't, it's a little bit of our ageism, right? Like where we're not thinking about the importance of individuals as part of the workforce. And I'm talking even over 65. And like how it's been impacted, that's actually something that the poll team should revisit, and how the pandemic has impacted that, and whether people who want to go back to work just haven't, because it's been hard, although there are remote options, but just because their lives have changed. Thank you.
A question online from Dr. Lucy, as he looks ahead, wants to know what the are there any characteristics of the super agers or predictions?
Yeah. Yeah, that's another topic. You'll have to bring me back out to have that talk now. But I will say this is, and some of this is it's not surprising, but what we find, and we ask about self-reported health, and who have self-reported good health and excellent health, they do tend to have more money, but they also report things like they're not as lonely. And, and I think that there's something to be said about that. I will say, as a clinician, as a geriatrician, one thing I noticed, and I noticed this in my grandmother, who I would say was a super ager. She made it to 97, and she was going strong, really, like mentally very, very sharp, is that anytime I saw patients in their 90s, they tended to just be loved by people. Like, I feel like you die of bitterness before that if you're not, like, I don't know, based on science, but it was just something that I always noticed. If I ever had patients in their 90s and beyond, they always had that loved them and that they loved. So, love deeply, I guess that's the secret. And of course, physical activity and, all those other things. Good genes help a lot.
Excellent talk. That was amazing. I'm a medical oncologist, and I'm curious if those with chronic required a lot of visits to physicians during the pandemic impacted loneliness at all. Just, we saw a lot of our cancer patients quite frequently during that time, that that those visits tended to have a lot of too.
Thank you for the question around, people with chronic health conditions. And we didn't drill down to specific health conditions, although we have some of those data, is that people who had poor physical health or mental health, like fair and poor, self-reported, had more loneliness, had more isolation. And I think, it's like, is it one or the other? And, to your point, like coming to the doctor may be like the best thing that you do all month for some people. And, people look, they chat sometimes. But I hope that when we ask about diet and exercise and like all those things, that we're asking about social interaction. And not that it's easy to solve, but the area agencies on aging, that their community organizations, that there are other things that can help, not help everyone, but at least some people who it's become, you know, this could be solvable in some people. I think it's actually harder to solve in young adults who are also having issues around loneliness. And I haven't figured that one out. But also give is that for all of us who have the ability to do so, check in on our friends, our family, our parents, our grandparents, our neighbors, you know, go visit them, call them, take them out for lunch. This is a big issue in terms of health.
Amazing survey population, and you mentioned some strategies to address some of the issues you've identified. Is this population available for intervention arms, and are there any that are ongoing?
Yeah, so they're not available for intervention, but anyone can use NORC. It's expensive, but all of our data are publicly available. Like we put them out, we usually try to get the papers written first and then try to put them out, but I think we have 5 or 6 waves on. So if you go to our website, thehealthyagingpoll.org, you can find the data sources, you can download on them, but there are at the University of Michigan, we actually do have like people who volunteer to be in studies, but I don't know that they're that representative because people who are coming forth. Yeah. But I hope we can do studies on things like loneliness and isolation, because it feels like it's ripe for that.
So my main source of medical information, the New York Times, had a article about the loneliness from the loss of the Zoom happy hours, et cetera, that people are now experiencing. You want to comment on that which is the opposite of
So that they had more connection when we were doing those.
yes.
Yeah. You know, it's funny, and my cousins did a Zoom's happy hour, and it was actually my favorite Zoom of the week because the other Zooms were not so good, not so happy. But you know, I think it's interesting. You know, early on, and I think about myself. You know, and my youngest child, who is a first year, you know, she wrote to college around the fact that it was really like kind of a neat little thing she wrote about that early time, that in a way you long for that, like, because you were just like kind of in your cocoon for not everyone, but you know, for her, she was safe at home. And like, she kind of remembers that time with nostalgia. And I wonder if it's the same thing where, you know, I'm like reading these, like what we were sewing masks for people, you know, we were all in it together. And I think in some ways we long for that. But what I would say is that, you know what, you can still do Zoom happy hour, and you can also do it in person. You can do it outside and do it safely. But that, you know, letting people know and actually just reaching out and saying, hey, we haven't connected. Yeah.
I think the challenge, I speak personally, like I did Zoom happy hours with my friends from med school from all over,
Yeah.
or you know,
Yeah.
friends from college, and now everybody is doing things, so
Right.
you can't do it.
That's
So
right.
I think it's that.
That's
Yeah.
right. And, you know, nobody was doing anything except me. But, you know, infectious disease physicians, critical care, you know, we were certainly busy, but my partner is a ENT, and he was home. And actually, like when he went back to clinic, I took a picture of him holding a sign that said my first day of clinic, you know, because, you know, he was sidelined for the first time in his life. Actually, a colleague of mine talked about that, her own loss of identity, because everything was about taking care of patients and train. She's an oncologic surgeon. And she said it really was kind of this very transformative time. But you're right. We got together with people we hadn't thought of in a long time. I'd say being intentional and planning ahead, because people will make time for those things. Yeah.
Well, again, Dr. Malani, thank you so much. Please join me in thanking her for wonderful grand rounds.